Continuing our Wellness Week here on Daytime. All week long, we are showing you the places that help keep your health and wellness in check. Dr. Nirzar Golewale have performed over 6,000 interventional procedures, treating conditions like varicose veins, uterine fibroids, and knee pain. I spoke with him how to learn how he treats his patients in a minimally invasive way.
Embolization is a minimal invasive vascular procedure wherein we place a small catheter through body like in the upper thigh or in the wrist, and we go to the targeted area where there is inflammation or a tumor, and we slow down the blood flow to that area. So that the whole procedure is called embolization.
Where can you do this? What types of procedures do you do this for?
Yeah, so various different kinds of procedures this can be used. Many painful conditions like joint pain from osteoarthritis, like knee pain, shoulder pain, hip pain, and also for certain tumors or non-tumorous conditions like enlarged prostate in men, fibroids in women, and even some liver cancers. It can be used.
Wow. And is this something that you do in a surgical center? Do you do in your office?
Yeah, it can be done in either or.
Okay.
So these are called office-based procedures. They do not require anesthesia. They are done with local lidocaine or numbing medicine or maybe a mild twilight.
Because you brought some of the tools that you would use typically in a procedure like this, and it's shocking how small things are nowadays.
Yes, yeah. So for example, this is a catheter that we use that, this is what is inserted through a wrist or a upper thigh. These are very small. So the technology has advanced quite a bit.
Yeah.
So these are, most of the patients don't feel these going in through their blood vessels. Once we reach the targeted area, then we inject these tiny beads. These are called particles or embospheres. So they come in different sizes and they are in micrometers. They are like sand-like particles.
Okay. So that blocks the blood flow?
That blocks the blood flow to the targeted area and then stops the inflammation.
So there's such a wide range of conditions then it seems like this could be used for. It's all based on inflammation, correct?
Correct, yes. So most of these conditions have chronic inflammation like osteoarthritis in the knees or hip or shoulder or even plantar fasciitis.
Really?
Yeah, so the patients who are not ready for bigger surgery or they're not a candidate for surgical joint replacement, this is a very good option for them.
How long does this last and or can you have it done again?
Yes, so this lasts several years.
Okay.
Studies have shown that these can be repeated also after several years. These are outpatient procedures. There is no recovery time with it other than for a couple of days. These are not painful procedures. There is no incision. We're not cutting into the leg or into the body. They're just inserted through a very small IV.
Wow, it's unbelievable. Yeah. Medicine is so fascinating to me.
Yes.
So you can walk into the office, say, with hip pain or knee pain from osteoarthritis, have this done. Are you pain-free immediately after the procedure?
Yeah, for the most part, they are pain-free. There might be mild discomfort just from the procedure standpoint.
Okay.
But for the most patients, I tell them, hey, take it easy for a day or two, and then they're back to, enjoying life again.
Who do you usually see the most to get these procedures?
Yeah, most of our patients will have some kind of joint pain, either long-standing joint pain from wear and tear. Most of the patients maybe 50 plus, in their age range. They have diagnosed with osteoarthritis in their knees or hip, or they may have plantar fasciitis, which could be younger population also. And then when we treat more like prostate issues, so that would be men, usually 50 plus, which is very common in men.
Yeah.
They have urinary symptoms. They have frequency, urgency. They have to wake up, multiple times at night to go to bathroom. So similar procedure is done to shrink their prostate so they don't have to have those symptoms anymore and they can avoid bigger surgeries.
I think a lot of people with arthritis, they think of steroid shots in their joints. Is this in addition to or in replace of those types of procedures?
Yeah, so steroid shots are still valid. It's a good option, but they do not last long enough.
Right.
They only last maybe couple of months, 3 months, and there is a limitation of how much and how many you can get steroids. And there are some side effects with having too many steroids in the body. So this could be done, either before that steroids, or maybe the patient already had those treatments before and they still would qualify for these.
Now, is this something that could be covered by insurance?
Yes, most insurances do cover it. Medicare, Medicaid, and some private insurances also cover these procedures.
Wow, this is fascinating. Get in touch with you, I'm assuming, for more information to see if you're a candidate for this.
Yes, yeah. So we have several locations. The patients can come to us for in-person consultation. We also do teleconsultation. We have locations throughout Chicago area, also Northwest Indiana. and we make the whole process very easy for our patients. They come in for consultations, so they are greeted by front desk staff. My team and I take pride in making the whole experience as easy as possible. We do all the testing, imaging in-house, and these are insurance covered. And then we work hard to make it a good experience for the patient so they have a good outcome from these treatments.
All right, for more information, visit ngvascular.com or call the number on your screen. You can also email them at info@ngvascular.com.